Hello dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic. Today we are going to evaluate the results of the patient who underwent a hair transplantation surgery in our clinic 18 months ago. This is a 26-year-old male who had a mixed type of the hair loss. The mixed type of the hair loss, most of the time we call the patient who have a different pattern of the hair loss or grade of the hair loss in different areas of the head. So he had the normal type 5 to normal type 6 of the hair loss, meaning most of the front side and the mid scalp were, as a hair loss pattern, were close to the normal type 5, and the crown area, due to its size and the distribution of the hair loss or degree of the hair loss, was closer to normal type 6. For this type of patients, on average, we may need the numbers varying between 5 to 6, maybe even 7,000 grafts. Of course, number of the grafts change from patient to patient depending on the size of the open area, the density you want to get, expectation of the patient, but the most important criteria here is the capacity or the ability of the donor area to give a sufficient number of the grafts to meet the expectation of the patient. As we have mentioned before in our earlier videos, for normal type 5 and above, most of the time a two-step surgery may be required to cover all open areas for the patient. Of course, this is slightly relative. Sometimes a two-step surgery may be required even starting from normal type 4, but most of the time, as a general rule, most of the time what we see as a normal type 5 and above require a second surgery. So the expectation of the patient was mainly to restore the front hairline, cover the front and the mid scalp, and depending on the number of the grafts, add more density to the crown area. The plan of the surgery was the reconstruction of the front hairline, covering the front side, mid scalp, and depending on the number of the grafts, go as much as we can to the back of the head. A classic two-step approach was planned for the surgery. In the crown area, the patient had a degree of miniaturization. It wasn't the completely open area actually. There was still some hair. And we also advised the patient the medical treatment. The medical treatment, most of the time we get these questions do we advise it to the patients? Yes, we do. Why? Because it's like a puzzle most of the time. With the surgery, we try to cover the open area as much as possible. But the medical treatment like finasteride, minoxidil, combination of both of them, or PRP, mesotherapy, they're crucial or the key factors to prevent furthermore loss of non-transplant hair. So you have the hair loss, we fit it in. But if all the time your non-transplant hair continue to shed, we may end up with new empty spots across the head. So it creates as a bigger open areas and more surgeries and higher number of the grafts even with the second surgery. So the plan was to reconstruct the front hairline, front side, mid scalp, and with the second surgery cover the crown area. In between two surgeries, definitely to stick up with the medical treatment to prevent furthermore loss. And here we can see the results. The front side and mid scalp is really well covered. Of course, it's not the density the patient had when he was maybe in his early 20s, but the fundamental idea of the hair restoration surgery isn't like the hair replacement treatment. It's the creation of the illusion of the hair. The idea of the hair restoration surgery is the creation of the illusion of the hair. It's when the grafts are placed under the specific angle and direction. So when they grow, they overlap with each other. We call them an interlocking pattern, giving you a good outlook of the hair. So sometimes we get the question from the patient saying, hey, I want the full coverage or full thickness of the hair. And we should set the expectation of the patient very correctly and appropriately without giving them false hopes, because it will misguide them. Because from the technical aspect, when we sometimes evaluate the patient, they have really nice results, but because their expectations can be like the full thickness or the density they had when they were really young, it may not be possible. Thanks for watching us. Stay tuned and good luck.